Hi everyone, welcome back to the channel, and in today's video, New York has over 100 deaths in one day, nurses wearing garbage bags as robes, and supermarket throws away $35,000 in groceries. Please like, share, subscribe, hit that bell notification icon, leave your comments down below, and follow me on Twitter and Instagram at TalkWithMe36. Governor Cuomo said today patients were staying on ventilators longer. More were dying from complications caused by the novel coronavirus. More than 100 people have died of the virus since yesterday morning, bringing the total to 385. The increasing death rate is partially a result of older and weaker people staying on ventilators for 20 to 30 days. The longer a patient is on a ventilator, the worse the chances of recovering. The number of virus patients hospitalized jumped by more than 40% in one day to 5,327, the sharpest increase in the past few days. The surge comes despite optimistic projections Mr. Cuomo mentioned on Wednesday, suggesting the rate was slowing as a result of social distancing measures. New York State has 37,258 confirmed cases as of this morning, up more than 6,400 from Wednesday morning. Mr. Cuomo said the state had enough protective equipment for healthcare workers to satisfy the immediate need, despite recent reports of nurses and doctors in New York City reusing masks and using trash bags as gowns. The governor said these nurses have enough protective equipment despite what reports are saying is actually happening. I will elaborate more because my next story is about the nurses wearing trash bags. Assistant nursing manager at Mount Sinai West, Caius Kelly, died from coronavirus on Tuesday night. The shortage of safety gear at one Manhattan hospital is so dire that desperate nurses have resorted to wearing trash bags, and some blame the situation for the coronavirus death of a beloved colleague. A photo shared on social media shows three nurses at Mount Sinai West posing in a hallway while wearing large black plastic trash bags fashioned into makeshift protective gowns. One of them is holding an open box of hefty, strong 33-gallon garbage bags they use to clothe themselves. "No more gowns in the whole hospital," the caption reads. The nurse sources said they were using the same PPE or personal protective equipment between infected and non-infected patients, and because there were no more spare gowns in the hospital, they took to wearing trash bags to stop the spread of the infection. Now I will elaborate on what Governor Cuomo said about these nurses having protective gear. If that was true, why are they wearing garbage bags? And I read the article on the nurses, and it was said at this particular hospital that they were basically short on supplies for about a year before this coronavirus outbreak even happened. So with everything that's going on, the situation is more dire, and to prevent the spread of this virus from patient to patient, because they had to wear the same gowns that they wear with a patient that was confirmed to have the coronavirus, they decided to just wear garbage bags and have to change every time they go from one patient to the other. A woman's so-called prank cost a Scranton, Philadelphia supermarket $35,000 on Wednesday when she purposely coughed all over the store's produce and on parts of the bakery and meat case, forcing them to throw all the contaminated merchandise away. The woman responsible was known by police to be a chronic problem in the community. Though they don't believe that she was actually infected with coronavirus, out of an abundance of caution, they worked with the local health inspector to get rid of everything she coughed on. After getting her out of the store and contacting authorities, over 15 employees worked to clean and disinfect the areas she visited. Now I'm seeing this more and more, hearing about this more and more. I did a video about this, I believe it was my last video, on how there was a guy who went in a supermarket and coughed on a woman's neck, claiming that he was infected with the coronavirus and that he is responsible for infecting 4,000 people, and sorry about that, that's my phone, and that he was also responsible for 44 of New Jersey's death from coronavirus. Then there was also another guy in Missouri who went into a store and started to lick the deodorants that was in the store on the shelves, I believe, and he took to licking on them, and also made terroristic threats and telling people who was afraid of coronavirus. Now I'm seeing this more and more. Some people are doing pranks, and some people are just. And with that guy with licking the deodorant, he posted it on social media. I seen this on TikTok. There's a lot of people doing a lot of stuff like that, and I'm gonna be honest. I laughed at it because most of the ones that I've seen, the people were actually a part of it, because I've seen that particular person who the prank is being pulled on TikTok. They have the TikTok of their own, so or somebody that I've seen on TikTok and YouTube, so I know they are actually involved in this prank. But people are, I assume some people are just doing it to get their 1 million views or whatever, and they're going about this. I even seen one recently of a guy going and licking on an ice cream. Open the ice cream, licks it, and put it back inside of the freezer, and that is very disgusting, and things like that needs to stop. These people should be prosecuted, because a prank like that, especially in the time that it is right now with this outbreak, with this coronavirus outbreak that's going on, people are scared, and no one wants to get this thing. Now I want to tell a story about this afternoon when I went walking my dog. When I went outside here to Fordham Road, and to my surprise, I saw a lot of people walking these streets, and they weren't practicing social distancing. I even ran into a man who stopped me to talk about my husky and how she was beautiful, and he started a conversation with me. This man's name is Andre. He is an elderly man walking with a cane, and he tells me that he is on dialysis, and yet he's outside hanging out talking to people. This guy just came up to me that I don't even know him, just to take a paper off of my jacket. I guess the paper is from my son when he's doing his remote class, and he has to write certain things on paper. I guess a piece of the paper got on my jacket, just a tiny little piece, and the dude doesn't even know me, stopped and took it off. And a lot of people is not practicing social distance from what I've seen outside. And some people believe, like, listen, they want to live their lives, and I've said this in numerous of my videos. Now Trump wants to reopen everything, or is hoping to reopen all businesses by Easter Sunday. I believe it's Easter Sunday or Easter Monday, whatever it is. But he wants to reopen businesses. Now, in my opinion, because I have two sides of it. My girl having asthma, she cannot get this virus. So, which I understand, she doesn't want to be next to anyone who has the virus, which can kill her. But on the other hand, how long are we supposed to keep everything closed? Okay, I seen a report today that unemployment has the most unemployment claims in history since unemployment started. It has the most claims in history. Some are even saying this is worse than back in 2008, or back when the recession started, back when we had the recession. It's worse than that right now. Most claims in history. So how long are we supposed to keep people from living their lives? Because a lot of us don't want to stay inside just for one day. So imagine if this thing goes on for much longer than April 20th. Let's see how that works out. And as Governor Cuomo basically said, he thought the needle was going the other way because of this distancing and keeping people home. But a day ago he said the needle was going the other direction, which is a good sign. And then today is like it's going the opposite direction again. And I don't think that this thing is actually working, because I don't think and I don't believe that these numbers are showing it's still spreading. And yes, it probably is still spreading, but I think these numbers is showing how many people was already infected, because they didn't act right away. It took them a while to act. And especially now when they have it that you shouldn't go anywhere or go to the doctor unless you are showing symptoms. And there's some people who are asymptomatic, who don't show symptoms whatsoever. So if they're not showing symptoms, they don't believe that they're infected. They will be walking around in these streets, going to the store, going everywhere, and infecting other people. And that's what's going to happen. And some people just, some people just want to get this thing over with. And the governor, didn't he say before that 80% of the population will, I don't know if he meant here in New York or the whole country, but if 80% of the people will get this, some believe that, hey, listen, let me get it now, let me heal up, or I die, but and let's get this thing over with. That's how some people are thinking. And then you have the young folks, because I see a lot of young folks not practicing social distances, and this is what's caused by the media and Dr. Oz, and knowing that Dr. Oz have kids, right? I believe he has kids. Don't you know kids think that they're invincible when you saying things like that? When you go around telling kids, well, it's not going to really affect you. Kids already think they're invincible. What do you think is going to happen? That's it for this. That's all I have for this video. I just wanted to give my opinion real quick on what's really going on here and what's going on here. But I'll see you guys in the next video. Peace.